TV's Dr. Oz, Donald Trump's nominee to be the next head of Medicare and Medicaid, once said that people who do not have private insurance have no right to health.
When you go home today, what should you do? I think you ought to think about 15-minute physicals. Your local hospitals will fund these. They're incredibly inexpensive to run. You can screen thousands of people for almost nothing, and you allow a conversation to take place in more of a festival-like setting. It's not scary. And I mentioned earlier that almost everybody who comes to our 15-minute physicals has a job, but a lot don't have insurance. Give them a way of crawling back out of the abyss of darkness, of fear over not having the health they need, and give them an opportunity, because they don't have the right to health, but they have the right to access, a chance to get that health.
Yes, these festival-like atmospheres, yes, because everyone, can be treated by going to a 15-minute physical between skee ball and bumper cars. Oh, you know what? For some reason, festival turned into carnival in my brain. Maybe because we're talking about Dr. Oz and the fact that he's a carnival barker. I don't know, but you get my point. And so, wait, hold on. You saying hospitals would fund these 15-minute physicals? Where are they getting that money? And once you get your 15-minute physical, what then? You still don't have insurance. You still can't afford to get actual care. This whole idea is half-baked. Okay, which isn't a shocker considering that this is a guy who was a celebrity talk show host, thanks Oprah, for many, many years, who was able to hawk many dubious miracle cures. Yes. Now, here's the thing though, okay? If you were talking about preventative healthcare being cheaper, right, then along with it being more beneficial to the patient, I think there's a lot of research that backs that up. So it's actually a great idea to have people go and be able to get their health checked out, all right, every year or, maybe a couple of times a year, depending on how old you are, things like that. Okay, it'd be a great idea. Wow, yes, get these diseases before they start to get, or these conditions before they start to get bad. I mean, imagine, seeing somebody who's pre-diabetic and being able to stop them from going into full-blown diabetes. I mean, that would be fantastic, right? Awesome. Why doesn't that happen? Why don't we do that? Well, because of health insurance, mainly. It costs too much to go and see a doctor, all right? Even when you have insurance, you are disincentivized to use it because of how much it costs. You got the copays, you got the deductibles, right? You got all these costs there, right? And so that's why people don't use their insurance unless they're really sick. All right. It just costs too much. It costs too much. Medicare, on the other hand, really doesn't. Medicare is a great program. Now, it's not free. I mean, there is a premium, okay? It's usually taken out of your Social Security payments if you're disabled, things like that. But generally, it's pretty inexpensive, about $174 a month on average. As far as the deductible, a $240 yearly deductible. Yearly. As opposed to $24,000 or $2,400. Sorry, $24,000. Yeah, maybe on some of those plans, over in the ACA marketplaces, you got $24,000, $15,000, just insane amounts of deductible for a lower premium, but nothing matches the premiums and deductibles that you pay on Medicare. That's what Medicare is a really good program, and the reason that it is and that it can cost so little is because of that. It's lacking that administrative bloat, that profit motive. I mean, you got like a 20% copay on the services that you get. Fairly straightforward. It costs way less than private insurance, which is why it's extremely popular among the people who have it. But Dr. Oz doesn't want everybody to have it. In fact, he don't want nobody to have it. He says, why don't we just privatize the thing and put everyone on Medicare Advantage plans, okay, who is currently on traditional Medicare. And then for everyone else, I mean, hey, why don't we throw you some festivals so you can, maybe get access to care. Right, yes, those 15-minute physicals are a great way. They're great for the uninsured, because they don't deserve health care. So they can at least know, though, what they're dying from. Great. Yeah, lovely. Love it. And by the way, all the others who can't afford, who have insurance but actually can't afford to use it for anything, well, I guess they can die too. Okay. Because that's ultimately what's going to happen. It's what happened before there was Medicare. It happened before Medicaid. It happened before the ACA. Poor people died from lack of health care, and they still do die. 68,000 people a year die from lack of health care in this country because we do not guarantee, like a civilized society, health care to everyone. Okay, we're uncivil. We're barbarians over here. Okay, the solution is simple: to do what every other industrialized nation has already done: expand guaranteed health care to everyone. In this case, Medicare. Expand Medicare coverage to everyone. Expand the benefits that people get. Get rid of for-profit insurance, all the private crap. All right, that's just benefiting people like the late Brian Thompson, okay, that's money just going into their pocket instead of going into healthcare for you, okay? Look, the thing is, the solution is simple, but people don't want the simple solution. Why? Because people like these health insurance CEOs and the politicians that they have bought and the media figures that they have bought make too much money playing the middleman, these insurance companies. All right? Every time they deny care for someone, they make money. I wonder where the incentives are. Not in providing healthcare, because they don't actually provide healthcare. They just provide health insurance. Insurance. Okay? It's almost like our private system is just one gigantic death panel. And Oz, he wants to be, well, he's going to be in charge of it if he gets, his nomination approved by the Senate. He's on board, with this privatization, okay? And the reason why is because he's taking money from these health insurance companies. That's why, okay? Look, he's taken about, what, $500,000? No, I'm sorry. He owns more than $550,000 in United Health stock. That's according to his 2022 financial disclosures. United Health is a Medicare Advantage plan, right? They administer a lot of these Medicare Advantage plans, which is just privatized Medicare. That's it. It's privatized insurance for seniors. And so United Healthcare, Medicare Advantage plans, same ones that, denied about 90% of their claims based on a so-called faulty AI model run by United Healthcare. Yeah, that made them a lot of money. Okay. Now, private insurance does not save money. Private insurance wastes money. According to reports, private insurers that run Medicare Advantage, like United Health, have been caught drastically overcharging for care. That company is currently under an antitrust investigation by the Department of Justice for its role in aggressively upcoding Medicare Advantage enrollees to secure higher payments from CMS. So, yeah, they're wasting money. They've also been sued on multiple occasions for doing Medicare fraud. And yet, because Dr. Oz has so many investments in it, he's in favor of just taking Medicare and handing it over to United Health. Under Dr. Oz's plan, United Health's revenue from Medicare Advantage would nearly double to $274 billion a year. A year. That would benefit him to a great amount. So there is a gigantic conflict of interest here. And yet he is just a few Senate votes away from actually being confirmed. I mean, look, here's what I think. If you're on Medicare right now and you voted for Trump, you should feel like an idiot for supporting him. But what are you talking about, Jeff? He said he wasn't going to touch it. He wasn't going to touch it. He doesn't have to. He doesn't have to for it to go away. Okay? He can just appoint the guy, which he did, who's going to obliterate the program. So in that way, he can lie, but also say, oh, what are you talking about? I didn't do anything to Medicare. But his crony did. He absolutely knows what this guy is all about. Because he lied to you. He lied to you. Okay? So I think, I just have to say, you know, if he's successful, congratulations, Trump supporters. You played yourself. Thank you for watching. If you enjoyed this video, please like, share, subscribe with the bell icon in order to get notified whenever a new video is released. And if you want to support independent, progressive media through this difficult time where it seems like everybody is shutting down, you can become a member on our YouTube page, you can become a subscriber on Facebook, or you can go to my Patreon. It's patreon.com/Jeff Waldorf. Thank you.